Hi, this is Shanae Beck, Head of Communications at APEC Med, an industry association representing the MedTech industry in the region, also known as the voice of MedTech in Asia. With MedTech evolving so quickly and reshaping healthcare in real time, we're launching a short podcast series called The Future Doses of Healthcare to spotlight real-world examples of this transformation. Welcome to Future Doses of Healthcare, Episode 1. Time flies in the tech world. When a game-changing tool like ChatGPT emerges, things can change so much in 1 year, even our daily lives. So what kind of changes will a decade bring? In the context of healthcare, how will AI transform hospitals and patient experience 10 years from now? To help me out, I'm joined by Peter Forbes, a seasoned leader at the National University Health System, one of the major public healthcare clusters here in Singapore. Peter has been its Group Chief Digital Officer since 2020. Welcome, Peter. Great to have you with us today. Would you tell us a little bit about yourself and what NUHS is?
Thank you, Shanae. Great to be here. So in my role as Chief Digital Officer at NUHS, I manage our digital strategy, which includes AI. And my team also support the adoption of digital technologies, which include things like Microsoft 365, enterprise social networking, and AI. National University Health System is an academic health system. We have 3 acute hospitals: National University Hospital, Alexandra Hospital, and Ng Tong Fong General Hospital, a community hospital in Jurong Community Hospital. We also manage 7 polyclinics, and being an academic system, we're also training many of the doctors and nurses which go into the Singapore system. We have around 16,000 staff. We manage 2,600 beds and we have around 6,000 students.
Right now, I would like for you to wear your futuristic hat in keeping with our theme today. And imagine that it's 2035 and AI is fully embedded in a hospital system in Singapore. So walk us through what a typical day might look like as a healthcare professional or a patient, choose your pick. How will AI change the experience at the point of care?
So there are lots of opportunities for technology and AI to support us in future. Of course, this is a crystal ball exercise, and so these are just some of my ideas, my views. What I describe here may in reality turn out to be different. Some examples would be at the point of care for patients and staff. AI could be more active in communicating with patients. So, for example, explaining lab results or explaining symptoms, educating patients on their conditions, and being able to do that in a natural dialogue with the patient. It could remind patients to adhere to their medication and give them nudges as to healthy behavior to help them manage their condition. It can also be a companion to patients in areas of mental health, and of course to provide personalized recommendations based on knowledge of the patient. So lots of opportunities there on the patient side. On the healthcare staff side, the AI could provide advice, so highlight to the doctor or the nurse a particular area that they may want to consider. Of course, the decision still lies with the clinician. So it's an augmentation, not a change in role from human to machine. It could make recommendations, similarly, make predictions. It could interpret images. And one area which is particularly exciting is the ability to take notes, to have the conversation between the doctor and the patient automatically transcribed, and then that go into the medical record system. At the moment, healthcare staff spend a lot of time documenting, and so this ability to do that is something which we see as very promising, again, to free up time.
Right. So oftentimes for technology, the reason adoption tends to be slower than innovation is the lack of capabilities to utilize or incorporate the technology. So how can healthcare professionals prepare for the hospital of the future? and what roles do hospital managements, academia, or even MedTech companies play in helping them?
So a key capability here is going to be the ability for health systems and their staffs to be able to incorporate new technologies into their workflow. So at NUHS, we're already training our staff in the use of large language models, for example. We're allowing them to experiment with large language models and find where it may be able to help them. We do have AI governance in place, so before any use case is implemented or adopted, then it has to go through that appropriate AI governance, and it's reviewed by a team of senior doctors who look at the use case and determine if it's appropriate. At NUS, the School of Medicine has also incorporated informatics into their curriculum so that new doctors qualify already technology literate. And another area which can be helpful, of course, is including technology in continuing medical education. That's another great way of keeping people up to speed and informing them of the possibilities of the new technologies.
At APAC Med, our nascent advocacy work on AI focuses on value capture, capability building, and ethics. So in our recent report with KPMG, we identified access, capability, and trust as the key enablers to realize the value of AI in MedTech or healthcare. So we've touched on capabilities earlier. So how are we doing on the access front? What is the appetite for hospitals to adopt AI solutions, and what are some hurdles they might be experiencing?
Mm-hmm. Yeah, so I like the access, capability, and trust framework. Before reading the report, I was thinking of the two key success factors for adoption of AI as being adoption itself, so getting those use cases into use by the healthcare workforce, and trust. And the two really go hand in hand, and they're interlinked. Adding in the capability portion is an important additional dimension. Coming back to the question on access, on the provider side, I believe that access to these AI solutions is fair to good. There are many different AI solutions available. Right. However, not all of those are available in the APAC markets. There are also some barriers to access, such as legal considerations, security, and privacy concerns over AI solutions. On the patient side, I would say access is currently more on the low end. This is because the trust by providers in those AI solutions is not yet there. So what we're seeing at the moment is that the AI solutions are there. They tend to be being used more for internal use cases, right. Things like the speech-to-text and note-taking, but are not yet sufficiently trusted to be used directly by the patients. There's still caution over those. Regulatory approval, of course, would be required for certain solutions, those considered as medical devices. And when it comes to things like large language models, there's still further work to be done to ensure that there are sufficient guardrails there such that the model stays within the boundary of the use case.
Singapore, shifting gears a bit, Singapore will soon be joining the ranks of a super aging society where 1 in 4 people are projected to be 65 or older by 2030. So what challenges will this bring for the health system, or the technology can be brought in to help?
Yeah, so the key challenge of the aging population is, of course, is that as we age, we tend to consume more healthcare services. Right. And also as we age, often patients, the population, are having more chronic conditions. So these are things like cardiovascular problems, diabetes, dementia, renal disorders, and so on. And the aging population also tends to have or often has multiple of those conditions, so what we refer to as comorbidity. So they may have both a cardiovascular problem and diabetes. Technology can help in managing those. So, for example, by remote monitoring via wearables, MedTech devices, teleconsultation, by AI analysis of the data which is coming back from that remote monitoring to provide early warning of decline in condition. And it can also offer personalized treatment plans and virtual healthcare assistance. So it can learn a patient's particular behavior or what they respond to. And so, again, like previous examples, the technology can start to cover off some of those patient interactions and augment the healthcare staff. We should bear in mind that this should always still be the human touch.
What about in the region? Where do you see the greatest impact? Because we talk about remote areas in Southeast Asia. Do you see healthcare access improving for these regions?
Yeah, so definitely as I look into the crystal ball, I see healthcare becoming more distributed. Today, it's either focused in the primary care clinic or the specialist clinic or in inpatient. Increasingly, especially here in Singapore, the intention is to move that out and distribute that more so that, for example, patients can be seen at home even for conditions which would previously have been treated as inpatient. And that work needs to be supported by technology to get data back to the doctors who can then make appropriate decisions. In more remote regions, technology can definitely help. A key requirement is, of course, that telecommunications are in place. If the telecommunications are in place, simply being able to talk to the patient over telephone or video, have that teleconsultation is the first step. Then things like monitoring devices can come in, even diagnostic devices. And so it can definitely help. Teleconsultation, telemedicine cannot cover everything. It's not appropriate for all conditions. Certain conditions still require physical examination. And so those will still come back into the hospital physical setting.
Right. So I'm not sure if you are comfortable commenting on places like Japan and Korea, but these are countries facing quite severe healthcare manpower shortages. How do you think technology can help these markets in their current plight?
Yeah, definitely, again, technology can help. So if we take a remote monitoring example, often today remote monitoring use cases will still have a care manager, for example, in the loop. So patient sees the doctor, then they're prescribed a course of treatment, they go home, they take their medications, they monitor themselves, that data is recorded, it's sent back in. A care manager will then be looking at that data on a dashboard, for example, and they will have periodic interaction with the patient. As more technology comes into place, then more of the work of that care manager can be automated through the machine. So it could be a chatbot plus a large language model. So the results are being interpreted. There can be a more natural dialogue with the patient. Some of the reminders that would previously perhaps have been done by the care manager, so calling the patient, reminding them to submit their blood pressure monitoring data, that could be handled by an AI. That can either be done by text message or it can even be done by voice in future. Of course, there's still the need for clinical knowledge and clinical oversight, whether that's coming from the care manager or the doctor, but some of those simpler tasks, those reminders, those repetitive things can be covered off by the technology and by the AI or AI agent.
For AI to analyze our health data and make such an impact on both healthcare manpower and patient experience, we need to let it do its job by trusting the AI and letting it analyze us as patients. So how easy is that? I suppose this is our last question. As AI becomes embedded in healthcare, how can trust be built in the ecosystem?
So there are a number of different things that we can do there. The first, of course, is within the healthcare system having appropriate AI governance in place, such that any AI solution that's put into use has been reviewed by a panel of experts and has been determined to be appropriate before it's put out into the world. The next thing, of course, is in doing that to make sure that the AI recommendations are explainable and that users are told when they're talking to an AI or when they're interacting with an AI. There should be rigorous testing put in place, and of course, repeatability is an important part of that. And validating that the AI is not producing biased results, and also tracking tracking performance benchmarks of that AI. So, of course, when it's first put in place, and then continuously while it's in operation as well. And in all of these things, taking into account patient privacy and safeguarding patient interests. Finally, of course, coming back to the human touch, maintaining the human touch is essential. This technology should be augmenting human healthcare workers. People are always required. Humans are required to listen, to understand, to provide empathy, and a crucial human connection. Because when people are seeking healthcare, they're often going through difficult times. They may be feeling unwell. It may be affecting their wider life and their relatives and family as well, of course. And some of those things, many of those things still require the human connection to manage.
So, Peter, thank you so much for your time and your insights. And a big thank you to our audience for tuning in. This space is constantly evolving, as you know, so please visit our resource hub at apecmed.org and check out our papers and our events to keep tabs on the relevant topics for MedTech in Asia. Stay healthy, and we'll see you next time.